Well, hi everyone. It is Friday, October 24th, 2025, and I figured I've been doing updates weekly on Facebook, kind of brief updates. I get a lot of texts, which I appreciate, asking how I am doing. So I figured I'm going to try and start a weekly vlog to get a little bit more in detail with what is going on. I will probably do two this week. This first one, just to kind of give you an introduction of what exactly type of breast cancer and what I've been through so far up until I started my infusions. And just kind of give you like a brief history of my surgery, the type of breast cancer, and my treatment plan. So hopefully, I'm hoping that this can help educate some of my family and friends, keep them informed. Also, if you know anyone that's going through this or just starting their journey, or you yourself are, that this will be helpful for you as well. Just know that this is my personal journey. Everyone is different. Everyone has different symptoms. Some people don't have many at all. So this is all disclaimer. This is what I personally am going through. So I'm not trying to say this is what someone else will go through. Just hoping to help answer some questions for people that are out there. I watched a lot of videos. Just try to learn myself. So I'm just trying to pass that forward and help people learn more. With that being said, I am going to start with when I was diagnosed. I've got all my notes here. So June 2nd, I went in for my routine annual mammogram and got a call back that same day, like within 2 hours, that I had to come back in. Now, I've had that happen before, so I wasn't too concerned. So I went in, they got me in 2 days later. Everything went super fast. They got me in 2 days later, and they did more mammogram imaging, and they did the breast ultrasound. After the breast ultrasound, they had me wait in the room, which was different than before. And the radiologist came in, and that's when she advised me that I would have to have a biopsy based on what she was seeing on the scan. So of course I was freaked out. Kind of came home. Keith went with me, of course. He was out in the waiting room. Or actually, I'm sorry, not when I was told. He was up in Flagstaff. I'm thinking of the biopsy. So called him. We started doing some research, both on our, on individually, and we're reading that about 80%. It was like 80 to 90% of biopsies come back negative. So that helped me feel quite a bit better, because it's kind of one of those things like, no, this possibly can't happen to me. Like, there's no way I have this, right? So, of course, I was still worried. Who wouldn't be? I was scared to get the biopsy. I had heard, I've had other friends who have had it before, and some family members, and, some of them were like, oh, no, it was fine. They do the lidocaine, everything's fine. Some had some minor horror stories where they felt everything. So I didn't know what to expect, and I was terrified. They got me in for the biopsy. So let's see, my first mammo was June 2nd. My second one was June 4th. My biopsy was June 12th. Thankfully, went smoothly. I didn't feel anything. I was very anxious, but definitely didn't feel anything. So I was very thankful for that. The radiologist told me that since June 14th or June 12th, the day of the biopsy, was a Thursday. And she said she would let me know by the next day because she didn't want me going through the weekend. The next day, I had taken off of work. Keith was off of work. It was torment because I had no idea what time she was going to call. So we were kind of sitting around the house just waiting and waiting. And then we're like, well, let's get out for a little bit to try to get our minds off of it. So we did that. And then we went to one of my favorite wine tasting rooms, and as soon as we were pulling in the parking lot is when I got the call. And that's when she confirmed that I do have breast cancer. And it is invasive ductal carcinoma grade 3, which I didn't know anything about. So she briefly explained a little bit. She said that it didn't appear to be any lymph node involvement, so I knew that was good. Hung up with her, of course, broke out in tears, called my immediate family. And then, of course, started my research because I was like, what am I dealing with? Everything went very quickly from then. I don't remember the dates of my appointments, but I think within a week of, I think it was the next week. So the biopsy results were June 13th. So I think it was the following week. I already got in with a breast surgeon who I love. She's amazing. So if you are in Arizona and you need anyone, I've got a really good one. Got in with her. So she explained everything in more detail, went over the biopsy results. She got me set up with an oncologist that she works with and a breast surgeon, a breast reconstructive surgeon, so a plastic surgeon. So you have basically the breast surgeon and the plastic surgeon that do the surgeries. Whether you choose a lumpectomy, mastectomy, anything, you work with both of them. So I got in with him, my breast plastic surgeon, like the first week of July, but right before then I had to get an MRI, and that was on June 30th because they had to verify no lymph node involvement, that it wasn't in the other breast, that the mammo didn't miss something. MRI was horrible for me. I'm very, very claustrophobic. So I basically wanted to try it without any drugs, which was probably a mistake. I did make it through, but not without them having to pull me out once in the middle, and I was having an anxiety attack. I was overheating. They had to put washcloths on me, a fan, and then, but I did make it through. It was a little bit larger machine. I was face down, so it was like everything I was breathing, I had like my face in something and I was breathing, and all that heat was like popping up back in my face, and I was just overheating, and it was just a lot. So I did make it through. I just kept telling myself, I need these answers. I don't want to have to come back and do this again. So they put me back in. I finished it, and then they pulled me out and they told me, we're marking your chart that if you have to have an MRI again, you have to be sedated. I said, fair enough. So that was June 30th. Those results came back pretty quickly. I mean, I want to say within that week, longer than like my CTs and all that. Those came back and definitely showed that I did not have anything in the lymph nodes, which is great. Right breast was fine, perfect. So, and it was measuring my tumor about 1.2 to 1.5 centimeters, which was actually great news, because that meant that if it was under 2 centimeters, I could have surgery first and get it taken out. Now, the other part of it was the type of breast cancer that the biopsy came back with is called triple positive breast cancer. So it's estrogen, progesterone, and HER2 positive. The HER2 positive is an aggressive form of cancer. So if you want to look it up or read about it, it's literally just HER2 positive is the short for it. And because of that is why I had to do, I mean, I guess I don't have to, but they suggest it and I chose it. The chemo and the Herceptin treatment. Because they basically say there could have been like a little tiny cell that got out into my body, into my, somewhere, and that would kind of go in and clean that up, get rid of it, kill it between the chemo and the Herceptin. Because, I mean, I would hate for it to pop up somewhere else and then it's metastasized and it's in a different location, and, that could be really bad. So those are the common treatment plans for the type of breast cancer that I have. But thankfully, like I said, I was able to do surgery first. Some people cannot do surgery first. The surgery was, another lots of looking up, reading about, trying to figure out what kind of reconstruction I wanted to have. My breast plastic surgeon that my breast surgeon referred me to, his office was amazing. I met with him. He kind of went over all the options between lumpectomy, single mastectomy, double, implant reconstruction, going flat, or deep flap reconstruction. I was so undecided. That was like the first hard decision I had to make. Obviously it's a big decision. That one was a hard one, but he has amazing staff. And after my appointment that day, we got home and he set up a Zoom call with someone on his staff that goes over with pictures and everything, all like those 3 different options. So she was on the phone with us for about an hour, went over the pros and cons. They did not try to sway me either way. They literally went over pros and cons for each one. And after that phone call, I hung up, and I remember I looked at Keith because he was on the call with me, and he said, "I think you decided which one you want." And I was like, "Yep." And seriously, before that phone call, I had no idea. I was so stressed over making this decision. So I did decide to do a double mastectomy with the deep flap reconstruction. And if you wanted to look that up, it's DIEP as in Peter. Basically, they cut me from hip to hip. They use my abdominal tissue, fat, skin, anything that they need from the lower abdominal area, and they use that to reconstruct the breasts. They reattach blood vessels. I mean, it's crazy what your body can do, and I am thoroughly amazed by what my body did. Now, there can be complications, just like with any transfer. The blood vessels, may not attach correctly, and you may not be getting the correct blood flowing, and you can have necrosis and all sorts of stuff. But I did choose to go with that. I wanted the more natural looking breasts that will, if I gain weight, they will gain with me. If I lose, they will lose with me. It was just the option that I preferred to have. They feel more natural. A lot of times I know with implants that because you're doing mastectomy and you have no breast tissue, there's really nothing to put those behind. So a lot of times for women who go through the mastectomies like this, they can flip, they can feel really cold because there's like no tissue keeping them warm. So for me, I was like, I don't want to deal with that. Not that it's wrong if someone wants to, if someone wants to try it. So I chose the deep flap. Much more invasive surgery. It was 9 hours long. I was in recovery for 3 hours because my left breast, where the tumor was getting a lot of hematomas in it. They didn't know if they were going to have to take me back in. Thankfully, they did not. So I stayed in the hospital for 2 days after that. Very, very minimal pain. I think they gave me some of the harder pain meds like the first day just to make sure. And by the second day, I was just doing like Tylenol. I mean, the belly where you're cut, and I've had a C-section before, is pretty numb. Even the breasts are pretty numb. So I didn't even really have that much abdominal pain like I thought I would, thankfully. So anyway, I mean, I that was on July 17th. I left the hospital July 19th and came home to recover. And definitely a long recovery. Have to sleep on your upright and an angle for about 6 weeks. Can't lift anything over 5 to 10 pounds for the first 6 weeks. You have to be careful with bending. You can't, raise your arms certain ways. I was stressed about all that, but I did it. So can do it. And then I did have a little bit of complications. My abdominal incision opened in like the left part of it, and I ended up having to go in because I was starting to run like mild fevers. And my actual surgeon, so there's 2 surgeons from the plastic surgeon office that perform the surgery. So the breast surgeon starts the surgery, removing the tissue, while they start working on the tissue on your belly. And there's 2 of them. So he was actually out of town that week that I had this infection. So I had to see a different doctor there. And she decided that it would be easier to just go in. I was having some issues with my breast incisions. They weren't infected, but they were like, they weren't really healing that well, and they were kind of opening a little more. So she decided to pull me back into the OR 2 days later after that appointment to clean everything up, clean the infection out of my abdominal incision. And she ended up, when she was in there, she ended up reclosing the breast incisions, giving me a negative vacuum machine to help keep them, like, putting the negative pressure on them. So that was August 14th. Yeah, that was August 14th. So it was exactly 4 weeks to the day that I had the first surgery. So I had those on me for like 5 days, then went in and got those taken off, and my abdominal incision has healed. I still have an issue under my left breast. The right one's healed. The left one still has like a quarter size area where the skin's still trying to form. But it is getting better, and it's now a superficial wound, so it's not deep or anything like that. It's just taking longer. So anyway, that was pretty much how the whole surgery went. Usually after surgery, you wait 4 to 6 weeks to start your chemo. But so that would have been probably like the beginning of September that I probably normally would have been starting it, or maybe the second week, since I had the second surgery. So my oncologist, I already had my 50th birthday trip planned, as some of you probably have seen on Facebook, to go to Vegas with 8 of my amazing girlfriends that were flying in from Illinois. I mean, all over. I've got one from Ohio, and then, my local friend that I go with every year. And I asked my oncologist, how long can I wait for my chemo? And I told him why, and he said he would let me go like 10 weeks, and that was like right on the cusp of the 10 weeks. So he agreed, and he's like, yep, go to Vegas, have fun. So that was great. That trip was much needed, and we had so much fun, but it was hard coming back because I knew the day after, literally that I got back from Vegas on October 1st, and I started chemo on October 2nd. So I did a good job about not thinking about it when I was there. There were times when I would think about it, of course, but for the most part, I was able to have fun and let loose and make so many awesome memories. So did my Vegas trip, and I started chemo October 2nd. I just had my 4th infusion yesterday. So I was going to maybe do 2 videos, but I think this is not taking too long. So I will just make this one a little bit longer, and I will talk about my first 3 weeks of chemo. Let me get that out. And again, this is what I've been experiencing. It doesn't mean that everyone's going to experience this. I'm trying to be as authentic and raw as possible, because that's who I am. As everyone knows, I'm a very, very positive person. I'm trying to stay as positive as I can throughout this, because I can't let this cancer take over my mental state. I just not that type of person. So I do have my moments, don't get me wrong. There's been tears, but they're short-lived moments. And I kind of get right back in to that headspace of making sure I'm still getting out. I'm still hanging with friends. I'm still going to my local restaurants where I know the people that work there, and I have so many friends that hang out there, and it is helpful. I can't just lay around the house. I'm sorry, my hair is shedding like crazy, and I will get into that, but I cannot just lay around the house. I need to stay active. I can't stay too active. I can't get my heart rate up, because the Herceptin that I'm on can affect your heart. But I'm trying to get my steps in. I'm trying to stay mobile. I rest when I need. I know when I need to rest. And I will rest. I will lay down. I will take an hour nap. But other than that, I'm doing everything I can to stay positive. I don't know how it's going to look several weeks down the road, but I'm trying. So October 2nd, my first chemo. I was terrified. So much anxiety. I didn't know what kind of side effects I was going to have. I was terrified of being nauseous. I was terrified of in my head, I was thinking, you know, way back when they didn't have all these nausea medications and stuff, and I was just thinking how people were just literally at home the whole time, or what it seemed, and sick and not feeling good, and you know, I was terrified. I mean, anyone would be, right? And so Keith took me to my first one. It was a longer one. It took about, the infusion itself took about 4 hours. And that's only because your first one, they give you pre-meds. So my pre-meds for me consist of, oh my gosh, Pepcid, Zofran. That's oral, so I take that orally. And then they give me Benadryl and then a steroid through my port. I do put lidocaine. I put a lidocaine, it's like a mixture cream, on my port about 45 minutes to an hour before I go and get the IV put in. The port's just right there. And that's just to numb it so I don't feel it, and it works really well. So the first one, they gave me the pre-meds. I had to wait 30 minutes for those to kick in. And then the Benadryl knocks me out. And then they gave me the Herceptin. And for some reason, the first week, the Herceptin took an hour and a half. They said something about the pharmacy didn't have them like pre-mixed or something, so they had to mix it as it was going in. I don't know. I was on Benadryl, so I don't remember exactly what they said. So I did the Herceptin. That took an hour and a half. I mean, I pretty much just sleep through it all, or at least have my eyes closed, because the Benadryl, like I said, knocks me out. And then after that, then they did the actual chemo, which takes an hour. And then they have to do a flush after, which is only about 5 minutes. So anyway, it took about, between getting the IV put in the port and getting the pre-meds and the waiting in between, it took about 4 hours. So that was that. And then I just kind of came home. I took a little nap and went back to work for a couple hours in the afternoon and just waited and see what happened. First weekend, that was Thursday. So Thursday, Friday, I feel pretty decent. It takes until about Saturday, so about 2 days after, I wake up, and usually Saturdays to Sundays, Saturdays are usually, so far, have been my worst, where I'm just fatigued, just completely fatigued. And the first round, I did take Zofran pretty much around the clock, like every 8 hours, just in case. But I didn't really have any tummy issues, and I didn't know if that was because I took the Zofran. Like, I wasn't really sure, but so that Saturday, I was very fatigued, and it just kind of feels like that when you have a cold, that clouded head feeling, where like you're walking around, but you don't really feel like you're doing it. I did take a nap that day. I took like a 2-hour nap that day, and then I had a really good friend of mine's 50th birthday party just down the street that night, and I made it there, and I made it 4 hours there, and I had a great time. But I started getting some weird stomach pains that night, not nausea, but just sharp pains. So we left there a little before 9, came home, and I pretty much went right to bed, and through the whole night I was having, these pains were getting worse. And I've struggled with diverticulitis in the past. I had a colon resection 3 years ago. Actually, 3 years ago, just on October 19th. And it felt a little bit different than diverticulitis. Now, I did have diverticulitis again in May and June of this past year. And it felt a little different, so I wasn't sure if it was that or not this time around. By the morning, I was in so much pain that I was in tears. So I had Keith take me to the ER, and they kind of confirmed that it was a diverticulitis infection. So they put me on antibiotics, and took several days. I mean, the pains got better, but even like the pain meds they gave me barely brought it down a notch. So I mean, I just had to kind of suffer through it at that point. They did give me IV antibiotics when I was in there, and then they gave me antibiotics to take it home. So came home, it took like, I would say Monday was better. I mean, I worked Monday, and it was better, but maybe 30% better, but it was tolerable. It wasn't those extreme pains that I was, in tears over. So it's kind of hard to gauge my first week because I had that infection on top of it. So I didn't really know like what to expect the second week. So the next Thursday, I mean, that was pretty much the only things that I had going on that first week. By Tuesday and Wednesday, and especially Wednesdays, I feel like a total normal person. It's like right in time to start my next chemo. But I mean, Thursdays, I feel pretty good, except for the Benadryl making me tired. So I've been able to make it to my trivia night every Wednesday, which is huge for me. So my second treatment then would have been on October 9th. I was having a lot of anxiety for that one again, because again, I only had one. I know chemo's cumulative and it, can add up. Or for a lot of people it is. So I went to my second infusion. My friend Sarah dropped me off for that one and picked me up. That one went fine when I was there. And actually my stepson flew in that night, and I was able to go out to dinner, meet Keith and him out for dinner. So I was able to get out of the house that night. Friday I was pretty okay. I think Friday we went and met Kyle down in South Phoenix for dinner. He drove up from U of A, and then Kyle ended up coming back here for the weekend. So that was nice. Saturday we went out. We took my stepson to our local brewery so they can watch the Ducks football game. So again, I'm getting out. I felt better that Saturday than I did the previous Saturday. I was still tired, but not like I was the previous Saturday. So I figured the previous one was because of the other infection I had on it. I did pretty well. I mean, we got out a little bit on Sunday and Monday, so I did pretty well that week. Or with that infusion. And oh, by the way, the chemos that I'm getting Taxol chemo and the Herceptin. So those are the two I'm getting. Some people have to have 2 chemos and the Herceptin. Everyone's different. I just needed the one because I guess I forgot to mention that when they removed the tumor, I did get clear margins. They removed 4 lymph nodes. And they did verify that there was no lymph node involvement and I had clear margins. So technically I have no evidence of disease after my surgery, which is great. So that was my second one. So then my third one was October 16th. And again, normal on Thursday, the tired from the Benadryl. I did see... Oh no, the 16th, the 9th, I saw my oncologist before the infusion. The 16th, I did not. I see him every 2 weeks. So the 16th, I just went in for my infusion, and now these infusions only take about 2.5 hours from the 4 hours from the first time. So they're able to give me the meds, the pre-meds, and then start it right away. So it really cuts down on the time. And the Herceptin is now only 30 minutes, and the Taxol chemo is still an hour. So my third one, I was more tired last weekend, but I still got out. I rested, but I still got out. Just not for very long, but it still helps for me to get out of the house. I rested most of Saturday until we went out for a couple hours in the evening and got dinner and stuff. But Friday, I started getting they consider it like it could be from the Herceptin or chemo-induced acne on my face. Never had acne. I mean, the random pimple here or there, but I've never had acne like as a teenager or anything like that. So this is all new to me. And it sprouted up, and I didn't put any makeup on yet, so I can show you because I want to show what I'm going through. It started on this side, and it's looking way better, but it started, I think there's there's a hair on my screen. It started on the right side on Friday. And then I went to bed Friday night and woke up, and it was like, and looks way better now, but it was all over here. It's like up here. I was freaking out. So Sunday morning, I had, an emotional breakdown with it and was saying, I'm going to stop the chemo. I'm not doing this anymore. I mean, I had to go through my feelings and my thoughts, and, I obviously decided to continue on with it because whatever. I mean, that's, my choice. And I just know that I had to, because if I were to get this back somewhere else, I would have been doing the what ifs. So I need to make sure that I feel that I can do as many as I can, and that I feel and know that I tried everything. So that's my mindset. Doesn't mean I don't go through the questioning a lot. So I got this acne, which thankfully, I don't know if I'm going to start getting it again with this round, but they advised me to use Vanicream for moisturizer. I'm using the Cetaphil for face wash. I'm using all very mild, because chemo makes your skin very sensitive and you can break out in rashes. So I'm using all mild stuff on my face. I don't really do much makeup, and I don't do foundation, so I just use a tinted hydrator. And it hides it pretty well. So thankful for that. But yes, definitely more tired this last weekend. And I had a little bit more tummy issues. I won't go into detail on that, but I did have more tummy issues. I did have times where I felt like I haven't been taking the Zofran around the clock, but I had times where I was feeling like it was going that direction. So I would just pop a Zofran just to stay on top of it. Like if it was just feeling off a little bit, I would take one, but I didn't have to take too many. I want to say they gave it to me for my infusion last Thursday. I probably took one on Friday, one on Saturday. I don't even know if I took any on Sunday, but Monday I did kind of wake up nauseous. So I took one, and I was, for some reason, on a Monday, which I'm usually starting to feel better, this past Monday, I could not wake up. I was exhausted. So I ended up sleeping in a little bit longer, and I just went into work a little late just to get that extra rest in and let that Zofran kick in. And then I was okay. And then Tuesday I was, no issues. And Wednesday I was great. So we'll see what happens this weekend. Trying to see, I think that's all I really have for so far my side effects have been very manageable. I hope they stay that way. I don't know if they will. But it's just really the fatigue and sometimes tummy issues, but I've had tummy issues for over 20 years because of all my other stuff that goes on. So thankfully, I'm kind of used to those. The hair loss is my next biggest stressor, as I'm sure, I think a lot of you probably know, a lot of people that know me. I've been going through it. I've been trying to decide when to do the shave. It still looks okay, but every time I brush, it's thinned out a lot, and that didn't really start until I started shedding after the last treatment, after the third one. And then really by last Sunday, Monday, if I brush or comb my hair, I get big globs that come out, to the point where I think I'm at the point where I may shave it this weekend or by Monday at least, because it's starting to bother me, because I'm feeling it all over my arms. It's constantly on my shirts, and I'm constantly picking it off, and I guess I just want to have control over that as much as I can. I don't want it to start coming out with clumps and bald spots. I've got a great wig. I'll be wearing baseball caps, and I think once I get past making that decision, I will have a lot less stress with a lot of stuff, because then that'll kind of be the final thing that I have to do. I started my treatment, so I kind of know how I'm going with those. Now it's just the hair thing. So, and like I said in my one long post last week or whatever it was, I know people say all the time, it's just hair, it'll grow back, but it's way bigger than that. It's part of my identity. And I know everyone means well, but just don't say that to someone who's going through this, because it's not easy to hear. Because I can guarantee you, they wouldn't be happy losing their hair and going bald. So that's my next biggest thing, is trying to decide that. And I think I'm kind of coming up on that cusp of saying, yeah, I just need to let it go at this point. I will be expected to lose my eyebrows completely, eyelashes, but some people don't even lose those until after treatment's done, and they usually grow back pretty quickly. My taste is still the same, so we'll see if that changes down the line, which a lot of people say it does, so I will keep you posted on that. So it does affect your nails because it affects all the fast-growing cells in your body. One bonus is I don't have to shave as often. My legs are been pretty nice and smooth. But other than that, I mean, I hope this kind of gets you guys up to date on where I am. Like I said, I'm going to do this. I'll start doing it now after. So next week I'll do my week 4. So whatever happens this weekend and so on. Update. If it helps you, watch it, like it. You can subscribe, I guess, to my videos. I've never done this before. If you don't, just scroll past because no one's going to make you watch it. This is just out there. So for the people who want to hear my more in detail updates, because on Facebook it's just usually a quick blip. And this is just for people who want to watch it, or for people out there that come across it like I did on YouTube with so many videos and information and very helpful for me. I don't want to scare anyone. I just want to try to educate people more. And that goes for any cancers. I mean, educate yourself. I can't believe how much I've learned just about breast cancer. And there's just so many cancers out there, and I know so many people who are going through them. And I just want to keep learning more about it, and I don't want to cry. So, oh, and I have to give a shout out to my dad because he's back in town. So he took me yesterday and he sat with me while I slept. I know it's not fun, it's pretty boring, but he went to my appointments with me. I am also going through physical therapy still for my surgery, which is helping. I have a lot of swelling still. And some of you probably saw my post yesterday. They're trying to get, which I think they will, I look like the Michelin Man. It's like a lymphatic drainage massage system that I can use at home. It'll be my own. I can wear it at home. And my swelling had gone up again. I think a lot of the fluids I'm getting in my surgery area, my upper belly, went up like 2 inches. I measure it daily. And so I went to my physical therapist yesterday and I was like, I can't, like, it just sticks out and it freaks me out. And we tried the machine. The rep happened to be there, so we were able to try the machine so she can try and get it approved. And then my physical therapist does the lymphatic massages, and it's within the last couple of days because I see her like twice a week. It's back down those 2 inches. So it definitely helped yesterday. So that was great. I was happy waking up to that. I only actually got 2 hours of sleep last night, so I probably look really, really tired. I will probably need a nap during work today, but that's okay. Shout out to my coworkers. You guys are all amazing for having my back through all this. I love you and appreciate you all. And yeah, I mean, that's about it. If you guys have any questions, shoot them my way and I'll either answer you directly if it's something more private or personal. Otherwise, I can address them in my next video. And also, if you have any questions for like Keith as a support person, supporting someone who's going through it, that I can ask him for you, maybe I'll get him to jump on a video with me. We'll see. But if anything, I can at least get him to answer the questions. But I appreciate all of you. I love you all. I've been getting tremendous support from so many people. I'm truly, truly lucky, and it's really helping me to stay positive, knowing I have so many people in my corner. And huge shout out to all my local friends who are always out there meeting me at the bars and giving me the hugs and all the good stuff. So I appreciate you all. I hope you guys all have a tremendous weekend, and I love you all so much. Bye.